for those. Meantime, hundreds of the world's top doctors, Elizabeth, are now warning, 239 of them signing this letter saying they want more public acknowledgement that the coronavirus can float and be transmitted through air droplets. But I have to say, when I read this, I thought to myself, don't we already know this? Isn't that why masks are so important?
Right. This gets very confusing, and it's sort of a distinction that scientists understand, but sometimes it's hard to really get it. So let's talk about this. Mostly what authorities have talked about, you can see it on the CDC's webpage, is that it spreads through sneezes and coughs. In other words, there has to be something propelling it. However, there's been a lot of talk that even just breathing can spread it, that you don't really need that kind of propelling to get that to spread the virus. And this is not a big secret. The National Academy of Sciences told the White House this more than 3 months ago, that they think just breathing can spread this virus. And so now these scientists, more than 200 of them, are telling the World Health Organization, let's talk about this openly. The word airborne is scary, but let's talk about this openly, that this does spread more easily, it seems, that's what studies are showing, than people had first thought.
So you just said that they're younger now, 35 to 45, and how that can be scary. And, you know, obviously the governor of your state, DeSantis, said that the median age back in March of cases was 65, and now it's 36, right? Which is sort of what you're saying too. And the reality of it is, doctor, you and I both know a lot of younger people think they won't really get sick, and so this doesn't really impact them. That it just is not an issue for them. What do you say to people who have that feeling, given what you're seeing in the hospital?
You know, that's a great point what you mentioned. So sometimes young people believe they will not get sick, and they believe like most of the diseases is for all patients. But this disease, COVID-19, is anybody can get sick, from the younger to the oldest. And I think that's what we see now. So as you point out, we're seeing everybody from 34 to 45 dying in the ICU. So the message to young people is they can also get sick, and they should also take care of themselves.
I'm not worried about COVID anymore. I think I'm more worried about the shooting, yeah.
Not worried, because each day crews know that the COVID-19 patients they drop off at this emergency field hospital have a very good chance of walking out just a few days later.
Our death rate is slowing. That isn't really what we'd modelled. It's not what we'd predicted. We thought that the deaths would continue and actually would be climbing quite dramatically. 100,000, 10,000.
Western Cape Head of Emergency Medicine, Lee Wallace, says early models predicted a catastrophe here.
In a way, it's lucky that you were later in this pandemic.
Definitely, we learned huge amounts from China, from Europe, from the US.
What they learned, use ventilators as a very last resort.
And the body doesn't do as well ever in those conditions. This virus causes a lot of damage to both the lungs and the blood vessels in the lungs, and you really need the body's own system to fight it as much as possible.
They started early on high-flow nasal oxygen instead, using gallons and gallons per minute for every patient, keeping them active and alert.
They looked at patients, said, we would a week ago have intubated this patient, and they were having bad outcomes. We're now using nasal oxygen, and they're walking out of the hospital.
Every patient on oxygen here gets anticoagulants to reduce the risk of blood clots, steroids too, confirmed by the results of a recent Oxford study showing they could save lives in the sickest of patients. The virus is now moving faster than ever here, with days of record increases in confirmed cases. The epicenter is moving quickly to Johannesburg. Doctors say predictions are a dangerous game.
We're being faced with so much failure in this whole COVID scenario. I think we've used the time well, but we were always going to question ourselves, did we use it enough? Did we do enough with the time that we were given during lockdown when the epidemic slowed?
But they hope that the lessons they learned treating patients in Cape Town will continue to save lives across the country as the pandemic surges.
What did these empty beds tell us?
I think, well, this is a hospital of hope, so I think they should give us hope that we can cope with the pandemic.
Empty beds is good news.
Empty beds is good news, absolutely.
David Mackenzie, CNN, Cape Town.